Now joined in the studio by Dr. Joseph Onigbinde, an infectious disease specialist, for an expert's view on this globally spreading virus. Thank you for coming on the news.
Good morning. Thank you.
Yeah, we just read that it's not a death sentence, but then this is causing a wave of fears among Nigerians, especially globally. What exactly do we really need to know in order to keep ourselves safe from this virus?
Are we assuming that everybody knows about coronavirus? I think maybe we should just summarize that coronavirus, like we said, it's not actually a death sentence. It is one of, it's a very large family that cause infections, respiratory infections, like common cold, SARS, and MERS. You know MERS?
Yeah,
Middle East respiratory syndrome. Those are the very severe form of the coronavirus infections. And they are zoonotic infections that can be transmitted from animals to animals and animal to man and from man to man. It is not a death sentence, like you said. If you look at coronavirus and compared to such other viruses like Ebola and so on, you see that it's not too terrible, though we must be very careful about it because the rate of spread, like you have read now, is very high. So, but it's not a death sentence.
So how do we exactly know those who are already infected? For instance, the issue of the Italian man had to report himself, and the driver, we saw on social media that the driver that conveyed this man from the airport to his destination also came out to say, I was a driver. And how do you think Nigerians should be wary of not getting infected by someone who has been infected already?
Yes, it is very good that the driver reported himself, and the man also presented himself to the hospital. And I also want to say kudos to the doctors who actually, they had their antenna up to, actually we have to investigate this man. But I think that every Nigerian, especially around this time, must be wary of when you have respiratory infections, respiratory symptoms, especially doctors and even individuals too. When you see that you may feel like coronavirus, when they first of all come, they don't present with specific symptoms, non-specific. It may you feel myalgia, just weakness, just have headache, just nasal droppings and all that. But when you treat the normal like malaria or something for 2 days and there's no response, I think 2 days is even too much. We should present ourselves as soon as possible to the medical expert.
As a doctor, the news was like, the story used to be, well, how ready is Nigeria? Now it's in the country. It's already in the country. So how impressive, or how do you find it, the way it has been, the noise, the news as fast it has spread, and then how the doctors are responding to this crisis?
Well, I must say kudos to Lagos State. That gives us of confidence. When you have outbreak like this, the Lagos State appears to be the port of entry. The healthcare system in Lagos is not too bad. Though it's not the best yet, but it's not too bad. The way that man was picked up is something very encouraging. Then contact tracing is the next most important thing to do. So I think, I won't say that we are very ready, because somebody called me yesterday. They said, if you know how Canada is getting, it's like a war. Every system is okay. We don't have that now. Our structures, like I always said, are not too good. The same mainland hospital, the only hospital we have to quarantine the people who are infected, is still, I visited it, is just like it was 30 years ago. So we are not too ready, but I think the government is up and...
But all the same, you are very optimistic,
yes,
we
should.
Right. Thank you very much, Dr. Joseph Onigbinde, an infectious disease specialist. Thank you so much for our expert view.
Thank you.